I want to talk about snoring. You are familiar with that for sure. Let me give you an example if you've forgotten. Snoring is a sound produced by vibrating tissues within the nasal and pharyngeal cavities. It is caused by turbulent airflow through a very narrowed airway. Many people do snore occasionally. Persistent cases are common in adults. They are not completely absent in children, so children do snore, but more adults will snore compared to children. It may be secondary to resistance in the upper airway, or sometimes not even that at all. Partner may be very uncomfortable. So, do we need to talk to your spouse? Of course, yes. It increases the risk of chronic medical conditions. What are the possible risk factors when it comes to snoring? It could be obstructive sleep apnea. I don't have to waste your time here because I've made a separate presentation on obstructive sleep apnea. Could be as a result of obesity. Could be secondary to tonsillar hypertrophy or deviated nasal septum. Sometimes chronic nasal congestion might be the only cause. Here we go. Smoking. Smoking could add to the problem. Of course, alcohol usage. Supine position is not so good when it comes to snoring. Though, changing your position to lateral recumbent may not assuage the problem. 44% of males will snore, while 28% of females will do the same. It's very pronounced in people between ages 30 and 60 years old, and is worse in individuals with sleep deprivation. So if you don't want to snore, make sure you are not having accumulated sleepless nights. It's associated with apnea or hypopneas. Sometimes found in people with cranio-facial anomalies. May be found in people with hypothyroidism or acromegaly. Some have adenoid hypertrophy, and that is the cause of the snoring in them. Could also be associated with pharyngeal collapse. What are the effects of snoring? And the first that I'll start talking about is not in people with occasional snoring. It's going to be in people with persistent snoring. So snoring in those that will be having the problem continuously may or may not alter their sleeping pattern. There is possibility of transient wakefulness because of increased respiratory effort. Hypopnea may occur and they can have fragmented sleep pattern. Oxygen supply is going to be affected for sure. Women and patients who had past surgery affecting their uvula, palate, and pharynx may not snore despite having obstructive sleep apnea or upper airway resistance. Let me repeat that. Women and some patients who had past surgery because of ovulum or palate or pharyngeal problem, having uvulopalatopharyngeoplasty, may not snore despite the fact that they have obstructive sleep apnea or they have upper airway resistance. If someone is snoring a lot and snoring on a persistent basis, snoring all the time, that could progress to obstructive sleep apnea. Don't bother your head, there'll be a new presentation separate. That will be on obstructive sleep apnea. So you get details there. Progression is likely going to be associated with increased weight. Hypopnea index is relatively related to weight gain and untreated obstructive sleep apnea. Increased weight gain is directly proportional to hypopnea index of 5 times per hour. In other words, if you gain weight, then your apnea and hypopnea index will rise. So the rate at which you have apnea and hypopnea will increase 5 times if you gain, think 1 pound or 1 kg. So it's not good for people who are snoring and are gaining weight. You'll have more trouble. What are the possible complications? There's likelihood of increased diseases like coronary artery disease, possibility or probability of stroke will be on the rise. It can come down with carotid arteriosclerosis, systemic inflammation, marital disharmony, particularly if the spouse would not be able to cope with that. Embarrassment. For example, you travel the company of colleagues and you have to pass the night, or you are having a conference, in the middle of everybody and in the middle of the night, or even during the day, you were so tired and you doze off, and the next thing is, you understand that? And somebody has to tap you, oh, you're too loud, you're snoring, you feel embarrassed. There's possibility of obesity, hypoventilation syndrome, particularly in those who are obese and snoring. They have hypoventilation, and okay, we'll go into details of that later on. And of course, could increase the likelihood of systemic hypertension. So to those who have modifiable risk factors for hypertension or non-modifiable risk factors, and then they are not handling the weight issue, the rate at which they come down with hypertension is higher. Other complications could be renal failure, diabetes mellitus, chronic lung diseases, gastroesophageal reflux disease, polycythemia, polycystic ovarian syndrome, heart failure, transient ischemic attack and stroke, pulmonary hypertension, and cardiopulmonary. Before leaving this page, I want to say 2 things. If you go over this list and the page before this, you realize all these associated complications will be found in individuals with obesity. That's it. So, now the second thing I want to talk about is cardiopulmonary. When somebody is having problem in the lungs, then the right heart failure will start failing. And you know the implication of that. How do we make diagnosis here? The first line of events will be to take appropriate history. You know what? We can get correct history from the affected person. So we're going to get the right history from the spouse or family members. And the questions will be how frequent, how loud, any associated apnea, Don't worry, I'll go over apnea in details the next presentation. Is the pattern such that there'll be silence, followed by loud snoring, any gasping, any choking sensation? Any daytime sleepiness, any non-refreshing sleep, restlessness at night, because might be as a result of periodic limb movement at sleep or periodic limb movement disorder or restless leg syndrome. Any decreased level of consciousness or concentration, any cognitive impairment. Has the moon be swinging as a result of this? Any headache in the morning? How about scary dreams? Increased urination at night? We need to find out all this. We are going to do physical examination and we'll be checking for truncal obesity. Truncal obesity is not good for anyone, and particularly those that are snoring. Truncal obesity should be put under check by doing everything to share their weight. And one thing is even common to people that are snoring. Some will notice that they snore or people complain about their snoring when they gain weight. So if that is your case, I think that's pretty fine because it means you can easily correct it on your own by shedding the weight. We're going to check for the neck circumference, particularly for large neck circumference. Crowded oropharynx, the uvula is big, the tonsils are enlarged, so you're not going to be comfortable seeing that region crowded that way. Nasal septal deviation, looking through the two nostrils and look for possible deprivation of the septum. Facial anomalies, check the maxilla, the mandibular, and cyanosis, whether we're dealing with central or peripheral cyanosis. And of course, we check for hypertrophy of the adenoid, and of course, hypertrophy of the tonsils. How about the features of hypothyroidism? Now, is this person weak, tired, cold, hair loss, macroglossia, big tongue, and so on, including bradycardia and them. Acromegaly with big frontal lobe. The head, the skull is now bigger, the palm are enlarged, and the face. Use questionnaires like Berlin or enhanced top bank questionnaires. And there are other ones. By the time we get to obstructive sleep apnea, I'll be able to raise more on that. Treatment. The first thing first, that is refer to ENT surgeon. So ENT consult. And while walking the way, maybe the appointment time is long and so on, let the affected person start the following. Decrease weight, but that can predict whether you get out of it or not. However, you will know as a patient, now talking to the patient, that your snoring is worsened or is increased when you gain weight. You will know that. So if that is your case, then you are lucky. I may not even send you to ENT surgeon. You have to watch that weight and shed it. Then you're fine. Stop smoking. Decrease alcohol intake. Sleep on the side, not supine. Not lay on your back, and not prone, not face down. Sleep on the side. Using posture alarms if you have it. special pillows by those who have it, or if people require some, and modified night shirts. They are all available to help. Decongestants, if there is nasal congestion, decongestants will help. Still on snoring treatment, pseudoephedrine could be used. Saline nasal irrigation, intranasal decongestants for 2 to 3 days only. Pseudoephedrine with domperidone if the situation is so severe. Of course, you can have nasal dilators. You can have nasal surgery depending on the determinant of the upper airway obstruction that is causing the problem. Then your ENT surgeon will make that determination. You can have oral appliances fitted by the dentist. And continuous positive airway pressure and bi-level positive airway pressure could also be given. And you can have what is called UPPP down. That is uvulopalatopharyngoplasty. Your ENT surgeon will make that determination. Radiofrequency ablation or somnoplasty using temperatures to control radiofrequency tissue volume reduction of the palate could also be done by your ENT surgeon. And you can have what is called upper airway exercise. With that, I've come to the end of the presentation as per snoring. The next presentation will be on obstructive sleep apnea. Obstructive sleep apnea, and there we'll be defining what an apnea is and everything related to that. So thanks for listening to my presentation. Kindly subscribe to my channel so that you can get these presentations immediately they are published. Thanks, I appreciate it.